I'm Dr. Michelle Rudd from the Bay Ridge Animal Hospital and Annapolis Cat Hospital, and today we are here to talk to you about dentistry and dental health in our companion animals. So, as everyone knows, your animals are always recommended to come in for yearly checkups, and one of the things we like to look at when they come in is their mouth. Everyone knows that their animals have teeth, and one of the big things we like to look at is, are they starting to build up tartar? Tartar is the hard, plaquey material that gets on the teeth when the bacteria sits on there for too long. Tartar is a natural thing that occurs just from eating and not brushing and not flossing, and we all know most of our animals aren't brushing and flossing after they eat. So we like to look at that and see when the tartar starts to build up too much and causes what we call gingivitis or infection in the gum tissue, then that's usually an indication for stepping in and doing a cleaning. Everybody hears the term dental cleaning, and we're going to talk a little bit about what's involved with that. Okay, so I have here a model of the dog's mouth. As you can see here, these are our teeth here. We have our upper and lower teeth. And you can see these teeth look pretty good. There's no tartar. The enamel, or the part that is covering the tooth itself, looks nice and healthy. Clean, no tartar or anything on it. And the gum tissue looks nice and pink. This is how we all start out. With time, we can start to develop a mouth that looks like this. Obviously, this mouth looks like it's probably pretty uncomfortable and doesn't look very healthy. You can see how red all this gum tissue is, and there's a fair amount of swelling starting to develop. This is because bacteria is all up under this gum and getting in there and creating a source of infection. Now you might say, well, my dog still eats or my cat still eats, so how bad can it be? Most animals will keep eating even if their teeth are falling out, so we can't really use that as an indication. If we were to start touching and probing these, we could tell you that would hurt, because most of these animals would probably either shy away from us or snap at us. And even when they're under anesthesia and we can feel them, a lot of times they'll even react. So we know these are pretty uncomfortable teeth. The other thing that you can start to see too is this heavy plaque that starts to occur here. And that's actually going to start decaying away at that tooth too. Also, you can see this in this mouth, there's actually breakdown of the tooth itself is broken, and you actually over time can get root exposure from that, and that's also quite painful too. So good, bad. We try and get to them before they get to this point with a dental cleaning, and that's what we're going to talk about next, the steps involved with cleaning and why we have to do it under anesthesia. Okay, so after you've seen your veterinarian and we've talked to you, looked at the teeth and decided that yes, your animal needs a cleaning, this is where we do them. All animals that require dental cleanings need to be under general anesthesia. Unfortunately, the only way to really get a good look at all sides of a tooth and all the teeth in the entire oral cavity in a dog or cat is with general anesthesia. Unfortunately, they just don't lay on the table and go, for us. So if your animal is over 7, we are going to do pre-anesthetic blood work, and we're going to make sure that all that looks okay and that their liver and kidney function will be able to handle the anesthesia. All of our dentals do have IV catheters placed, and they are an IV fluid therapy during the procedure just to help support their liver and kidney function and their overall blood pressure. When they have the anesthetic procedure, we use a machine like this here, and this actually allows us to deliver gas anesthetic through a tube that is placed into their trachea, very much like when we have anesthesia too. So we give them some pre-medications to get them nice and sleepy, put them on the gas, and then we can clean their teeth. Also too, while the procedure is going on, there's always a technician monitoring anesthesia, and we do have anesthetic monitoring equipment so we can monitor how well they're oxygenating, what their blood pressure is doing when they're under anesthesia, what their heart rate is, and in general, make sure that we keep them as safe and healthy as possible while we're doing the cleaning. When we go to do the cleaning, we have an ultrasonic scaling machine like this here. What happens, the technician will do the scaling of the teeth, and what we'll do is, with the animal laying on their side, we will actually use the ultrasonic scaler to clean every surface of every tooth. And we clean the front part of the teeth, we clean the inside of the teeth, we clean the back part of the teeth, and we get those teeth as clean as possible. Once that's done, then the doctor is going to come through and do a thorough oral examination of that animal's mouth. And when they're under, this is where the anesthesia is helpful, because we can open the mouth and we can look at all angles of the mouth. And the mouth isn't just the teeth. You've got tongue, you've got hard palates, you've got soft palates, you've got a palate down here, and all of these things can be affected by dental disease. And also, unfortunately, we do find masses and things like that in there too that we want to address. So that's why it's so important that they be asleep and as still as possible. We can use various different tools to help with that, but the big thing we like to use is a probe, and that allows us to probe up under the gum line in these guys and check to see, you know, just because the tooth might look normal from the outside doesn't mean there couldn't be a pocketed area where infection is, or even like in this guy's case, fractured teeth where there's root exposure. So we like to check that too. So that's part of a good exam, is to get up under that gum line and check every single tooth, all parts of the tooth. Okay, so after we do the full cleaning and your veterinarian has probed the teeth and done a full oral exam, if we have any teeth that we are concerned that may be too loose, decayed, or a source of infection for your dog or cat, unfortunately most of those teeth need to be surgically extracted and removed, because they're only going to provide more of a source of infection and discomfort. But before we do that, we can take x-rays to see, one, whether we can save the tooth, or two, if we do remove it, if we need to be concerned about any of the other structures that it's attached to, like the bone and the socket. Probably everybody has seen something like this at their dentist. It is a dental x-ray machine. We do offer dental x-rays, and we have digital dental x-rays, which is nice because it means it's quick and it's less anesthetic time for our patients. When you take an x-ray, we actually can do it right here at this spot, and it comes up on our computer. And we can use this to enlarge it, shrink it, change it, and it allows us to see if we need to extract a tooth, or if we do extract the tooth, to make sure that none of the root has been left behind or anything else that might cause a complication. Okay, once we have done the cleaning, the exam, the x-rays, and any extractions that need to be performed, the last step, of course, is to polish. And just like with the cleaner, we polish all the surfaces of the teeth. This is really important too, because when you scale the teeth, you will leave behind small grooves in the enamel that need to be filled in with the polish to help prevent tartar from building back up again as quickly. And then once we do that, we will do a fluoride therapy, and then we allow the animals to recover, and when they are fully recovered from anesthesia, they get to go home. All of our dental procedures here are outpatient procedures. They come in the morning and do get to go home with you late afternoon, early evening usually. Okay, so as you can see, we've gone through the steps involved with the dental cleaning, and after your animal goes home, remember, the tartar's going to come back eventually, because they're just not brushing and flossing after meals. There are certainly things that you can do to help prevent that besides brushing, in case your animal won't let you brush. But please talk to your veterinarian about ways that you can prevent tartar buildup again and slow the progression of dental disease. Remember, while the teeth are important for chewing and swallowing, they also, when they get bacteria, will provide a source of infection that can go through the bloodstream. We know that this bacteria can get itself into the heart and into the kidneys, and can be partially responsible for why kidney disease and heart disease develops in our older patients. So, if we can keep that bacteria off their teeth, keep their teeth healthy, we'll improve their overall organ function, and of course the most important part, keeping them as our companions for as long as possible. Thank you again. I'm Dr. Michelle Rudd from the Bay Ridge Animal Hospital and Annapolis Cat Hospital.